The other thing is that we have to remember, if we're talking about this in terms of chronic stress or in terms of chronic trauma, with trauma, stress hormones go out of control. And with stress hormones going out of control and being really high, whether that's cortisol, epinephrine, norepinephrine, adrenaline, it inhibits the immune system. Cortisol will actually reduce your immune system, your immune functioning. And it also, when you're in that chronic sympathetic overdrive, I was saying with the digestive issues, you can't get into that parasympathetic rest and digest, chill out, recover, recuperate state. So people are not digesting. They're not able to sleep very well because you have to go into parasympathetic to be able to sleep and to be able to poop, to be able to digest your food. Like you have to be relaxed enough to do those things. And so with these prolonged levels of these stress hormones, it just becomes this snowballing, spiraling effect of what we call sympathetic dominance, or lack of parasympathetic tone, lack of vagal tone. And there are certainly ways to adjust that and increase more parasympathetic state, but it requires active input, or somebody has to actively work for, meditation, breath work, yoga, physical activity, as long as it's gentle physical activity, not the like really intense activity that's just going to push higher cortisol, higher stress hormones. And certain herbs, certain things that people can take to help digestion and bring them into cold exposure or warm exposure, saunas, like a lot of things. But it takes work, because if somebody's been caught, constantly in this fight or flight for decades, it's not something that just unwinds on its own.
Yeah.